Hello, welcome to this screencast. My name is Yanfu Chen from the University of Warwick. I'm presenting a scoping review on behalf of the Improving Health in Slums Collaborative, which is a research project funded by the UK NIHR. In this review, we look at factors associated with accessing healthcare and provision of health services for slum residents in low and middle-income countries. We know that a significant number of people live in urban slums in developing economies. They not only face adverse environments, which could be detrimental for their health, but often have difficulty in accessing healthcare. We therefore undertook this scoping review to help us to identify ways to improve health service in slum settings. Briefly, we searched across multiple databases in April 2020, and we examined the studies published from 2016 onwards. We identified 92 studies of various study design. Most studies are of quantitative design. Study has wide geographical variation, with most studies coming from Asia, particularly India, followed by studies from Africa, particularly Kenya. One notable finding is that the vast majority of studies have looked at factors associated with healthcare seeking behavior and healthcare utilization from slum residents' perspective. Relatively few studies looked at factors associated with provision of healthcare services from providers' perspective. Included studies reported diverse factors, which we try to classify according to a framework that is constantly refined over the course of a review, and here is a final framework that we end up. A prominent example of socio-economic factor is that some slum residents cannot afford to visit healthcare when they need, because they have a higher priority to use the time to make their daily earning to cover their basic needs. Another example would be previous experience of being badly treated by healthcare providers due to their slum residents' status, which subsequently influenced their health-seeking behavior. We only have time for this very short introduction, but please feel free to contact us if you are interested in more of our findings. Thank you for listening.